Hello and welcome to Health Matters on Channels Television. Thanks for joining us. I am Mary Alale Yusuf. For 13 years, the Union for International Cancer Control, UICC, has organized the World Cancer Day to end preventable suffering from cancer. I Can, We Can is the theme for the next 3 years, suggesting that everyone has a part to play in addressing the cancer burden. The World Health Organization estimates that 30 to 50% of all cancer cases can be prevented, and prevention is the most cost-effective long-term strategy for the control of cancer. One of my guests is the immediate past Chief Medical Director and previous Dean of the Faculty of Clinical Services at Bowen University Teaching Hospital in Osun State. He's a pioneer of the subspecialty of orthopedic oncology in Nigeria, with a bias in bone and soft tissue oncology. That's Professor Samuel Eyesan. Here also is a consultant radiation and clinical oncologist who is currently the medical advisor for Sanofi Aventis Nigeria Limited, a multinational pharmaceutical company, Dr. Tomi Fakolade. You are welcome to the show, gentlemen.
Thank you.
Thanks for having us.
Prof, let me start with you. Are there some cancers that are totally preventable, in which case nobody has to ever get them ever?
Yeah, it's getting to be that now. Cervical cancer, for example, is totally preventable now because vaccines have been made that are targeted at the viruses, the HPV virus causing this cancer. At least 80% of the virus types causing the cervical cancer have vaccines now readily available. And once the country can bring them in and give them to the girls who are between the ages of about 10 to 20 when they are not sexually active, they can be prevented. Cervical cancer can be prevented in those.
It's important they must not be sexually active when they are taking.
Yes, that's because by the time you are sexually active, you believe that you may have been the virus may have been introduced in your bodies with antibodies formed against it, and we don't know the reactions yet. Okay. So we want to give those people who are young first, and it's just that most African countries are beginning to have that.
Any other cancers that can be totally avoided?
No, but there are cause and effects. There are risk factors that we can work against.
Let Dr. Fakolade tell us about these risk factors.
All right. Risk factors. Now, let me just add something to what Prof has said. Actually, about 50% of cancers can be prevented. But then he has explained to us that usually many of them have these causative agents. And when you can prevent those causative agents from having access to the patient, then such patient likely may not have cancer. For example, we know that Kaposi sarcoma is a cancer that is caused by the human herpes virus, which is usually made more advanced in HIV or AIDS, full-blown AIDS, for example.
Epstein-Barr virus?
No, it's called the HHV8.
Okay.
The Epstein-Barr virus is indicated in usually in non-Hodgkin's lymphoma, Burkitt's especially, Burkitt's lymphoma, and then again in what's it called now? Nasopharyngeal cancer. Okay, so that's the Epstein-Barr virus. So we actually have a list of viruses, which we have mentioned in passing: the human papilloma virus, which Prof has mentioned, the human herpes virus, the Epstein-Barr virus, and quite a few other viruses that are known to cause cancer. Again, there are risk factors.
Yes, let's move into those risk factors.
Yes, that you can be exposed to. For example, we know that smoking would cause lung cancer, and we know that sexual activity would promote cervical cancer. Beyond that, I like to classify risk factors into two categories. We have the modifiable and the non-modifiable. So for the non-modifiable, things like gender, we know that in breast cancer, 90% of breast cancer patients are women. Less than 10% are men. So you know that being a female is a risk factor for developing breast cancer.
On the other hand,
prostate cancer. A woman cannot have prostate cancer because it doesn't even have a prostate in the first place. And then again, you think of things about age. Some cancers are commoner in the earlier ages. For example, cervical cancer is commoner amongst the sexually active. Definitely. And then maybe a few years after, as against some cancers like that are childhood tumors, for example. Retinoblastoma, that's the tumor of the retina, is commonly found in children. You know, so you have age being also a risk factor for particular
so if somebody
cancers.
escapes that as a child, there's little likelihood they will get that.
There's a minimal likelihood that he would have retinoblastoma as an adult, unless we have maybe immunocompromised situations like HIV. Then that can reawaken that possibility of having retinoblastoma in adulthood. But usually, it's a disease of childhood, for example. Okay,
Prof, can you tell us, just give an idea of how big a risk factor tobacco use is?
Now let me say, there are studies that have been done confirmed. Smokers and non-smokers. Smokers stand a chance of dying 15 years earlier than non-smokers. That's a big thing. Although it's not only cancer of the lungs that will cause that. There are other things that the smoker will cause. But we know that virtually all the cancers you can think of have tobacco as a risk factor. Breast,
huge one.
Breast, esophagus, lungs, colon, all of them have tobacco as a risk factor. So it's a major risk factor in cancer, and has been confirmed. So that if you can reduce that tobacco smoking all over the world globally, will cut the risk of lung cancer by over 40%.
Wow, 40%.
Yes, straight away.
Now this theme that is for the next 3 years, I am, and we can, we are, we can, whatever. It's ending at the end of 2021. Okay. What do you hope we would have achieved by that time? Because we have to take a step forward. That's what this is all about, isn't it?
Everything is about this. Cancer, World Cancer Day is about cancer advocacy. We want to let people know that cancer is a curable disease, and if you have it, you don't have to die. We can do it, and it's possible. And I think in the next 4 years again we may have to extend it, because advocacy, we can't stop it. People don't know about it at all. There's so much. I don't call it illiteracy. I will call it just people are just careless and they don't know that.
Perhaps denial too.
Denial is also very important. Denial, illiteracy, poverty, of course, our dietary habits. Those things need to change, and we will have to preach it and let people know that these things are possible, because we know that most of these naturally occurring things too, also like fruits and all these vegetables, are antioxidants.
Which means they are cancer-fighting agents.
Yes, because as you walk around, do everything, your body generates what we call free radicals. And it's been postulated that these free radicals, if they get too much in the body, they can land on any tissue and stimulate carcinogenesis.
Okay. So that perhaps is part of the we can. Yes. They should get educated, know about it, so that you can at least have an informed choice of what to do.
What to do. Because once you take lifestyle modifications are now beginning to prove important. You cannot begin to do what you used to do when you were young, much younger. We know that these cancer cells dwell on sugars, for example.
Aha, there's that. So sugar feeds the cells.
Yes, cells live on sugar for energy. As you live on it, you get the energy by taking carbohydrates.
So if somebody were to cut out sugar, maybe refined sugar from their diet,
it will help. Because as you grow older in age and everything, a lot of things change in your body. And if there are already some cells that are undergoing carcinomatous changes, and you now feed them with sugar, then of course they will grow faster. I'm not saying sugar is good, but you have to, everything must be in moderation.
And then if you are knowledgeable, then it also informs your choice better.
Yes, of course.
Dr. Fakolade, you are into pharmaceuticals.
Yes.
Is there anything new on the horizon by way of treatment or drugs, if perchance someone does have cancer?
Yes, there are things that are new. For example, we're looking beyond. Before now, it was so much of chemotherapy. But now we're going to the avenue, into the advent of targeted therapy, where we can identify the gene responsible, and then you can formulate a medication, a molecule that will address that gene, And so, because in chemotherapy, other innocent cells suffer.
That's correct.
Yes, but in targeted therapy, what we're doing is just the offender pays, and then side effect profile is improved as against therapy. So it's a journey, right? And we will get there. But beyond the molecules being formed, I think the people need to take ownership. So you mentioned denial a while ago, and I think that's probably our biggest challenge in this part of the world, where it's never our portion, And when you're driving a car and you hear a funny sound, you don't say it's not your portion. You call on your mechanic, right? Or you go to the engineer's place, workshop. Or if you're in your kitchen and you smell cooking gas, you don't say it's not your portion. You look at the cylinder and look at the adapter and be sure there's no leakage.
We use cooking gas.
Yes, that's what I'm saying, that you respond to that symptom.
Okay.
Yes. But in health, most of us are in denial, even when in the face of symptoms. And that is a big issue for us because, like Prof said earlier, cancers can be cured if they show up early. But because of our denial, we waste time. And by the time we are presenting finally at the hospital or at the specialist table, it's advanced. And at that point, there's really not much anyone can do. Whether it is chemotherapy, whether it is targeted therapy, at that point, there's a limit to what we can do.
Early detection, early reporting. Prof, what are the things that stand in the way of access to care? Because the problem in Africa is that people always say, oh, he came too late. Or why didn't he come? So there must be some obstacles.
Yes, you see, the challenges we have, both for the patient, the family, the community, the Christian faith, and even healthcare systems. The challenges are there.
Okay, let's take a quick break. When we come back, we continue from where we stopped. Stay with us. We are going on a quick break. We'll be back.